evening, and welcome to Creative Broadcasting, the station of unlimited possibilities. Presents Creating Your Seat at the Table with your host, Ashley Little, as she welcomes her guest to the table.
Welcome to Creating Your Seat at the Table. My name is Ashley Little. A little bit about myself: corporate professional by day, entrepreneur by night, four-time best-selling author, CEO and founder of Ashley Little Enterprises, LLC, owner and creator of Creative Broadcasting, and co-founder and owner of Talk Radio and TV Network, LLC. Tonight, we have an amazing special VIP guest by the name of Tianna Bynum. A little bit about her. Tianna is a board-certified nurse practitioner and native of Prince George County, Maryland. She attended North Carolina Agricultural and Technical State University, where she graduated with a Bachelor's of Science in Nursing in 2004. While attending North Carolina A&T, she was initiated into the Alpha Mu chapter of Delta Sigma Theta Sorority Incorporated. Tianna was commissioned in the United States Army Nurse Corps and served honorably for 6 years before separating in 2010. She received her Master of Science degree from Georgetown University and completed the Family Nurse Practitioner program. Her professional focus is now to provide holistic care to a diverse population, concentrating on health promotion and the reduction of disease morbidity and mortality among minorities. Her company, Holistic Practitioners, was created with the idea of restoring the entire body to a state of optimal health. Tianna is also a wife and the mother of a beautiful daughter. Welcome to the table, my amazing big sister, Tianna Bynum.
Good evening, Ashley Little, and to all the listeners tuning in. Thank you so much for having me.
I just want to say I'm honored to have you at the table. I can't wait to hear all the knowledge and wisdom you're going to share with our listeners tonight. And I know they've heard your amazing bio. So please tell us more about your entrepreneur journey.
Thank you. It is my privilege. So my journey as an entrepreneur probably didn't start like most. It was never really my dream to be an entrepreneur. I never said that one day it's my goal to own a business. I always knew that I wanted to be a nurse, and I knew that part of that came with working for a major organization or corporation, and so I was pretty content with that. But as I became more knowledgeable, and as my career advanced, I knew that working for different organizations, it kind of forced me to adapt and conform to their particular way of handling things. And when it comes to healthcare, there's a very specific population that's often overlooked. So you have healthy people with private insurance who have access to whatever kind of care they want, or you have healthcare organizations that focus on the underserved and those with poor health. But there's not a lot of care for those in between, those who suffer from physiological and mental health issues combined. So with that in mind, I said there has to be a way in which we can touch patients and touch clients and focus on the entire body.
And I just want to commend you for creating that space to close that gap, because we do, as we all know, mental health is definitely serious, right? And it's something that we need to pay more attention to. So thank you for creating that space and, your willingness to close the gap there.
Thank you.
And you are the CEO and founder of Holistic Practitioners. So tell us about your company and how we can support and get involved.
Okay. So Holistic Practitioners is a pretty new concept. The idea behind the company is to secure a space, and whatever that looks like, whether it be mobile clinics or a fixed location. And the purpose of the business is to not only focus on Western medicine and Western medicine practices, but to also incorporate lifestyle changes, naturopathic medicines, herbs, whether that be medical cannabis, supplements, physical fitness programs, nutritionists, a facility that would actually have all of the resources, or to be able to provide all of the resources so that patients did not have to leave and go to see somebody here, go to another facility to get another idea, another specialty care, but to be able to come to one place and receive health care that encompasses the entire body and fulfilling all their needs so that they can maintain optimal health.
I love that. And are you partnering with different businesses to do this, to expand it, in different areas and states?
I am. And actually, I do have an herbalist who I have been in the works with. I have met with Tianna Bynum, and she has introduced me to some other entrepreneurs who are in the medical cannabis business. And then I have a couple colleagues who are into physical fitness and nutritionists and dietitians who would actually be willing to lend services and provide consultation to my clients.
I love it. And where can listeners go to, or how can they support and donate? Are you up at that point yet where they can donate or sponsor or support in that way as well?
So we're not there yet. So one of the things about healthcare, as you know, which is a big topic in our current political debate,
right,
is when it comes to insurance. So there's a couple grants being written to obtain privilege for Medicaid and Medicare services to be able to treat those patients who don't have healthcare coverage, in addition to gaining privileges through major and private corporations such as Blue Cross Blue Shield, Aetna. And so there's a very rigorous process that providers have to go through to be credentialed to be able to bill for their services. Because while my passion and my drive is to be able to treat people, it is my livelihood and it is my passion and my career, so there has to be some compensation in order to keep the business going.
Amazing, amazing. And you're passionate about providing holistic care to diverse populations, right? Concentrating on health promotions and the reduction of disease and mortality amongst minorities. So would you please tell us more about your passion and, how you plan to continue to close those gaps?
So one of the biggest things, if anyone is listening is involved in healthcare, they know one of the biggest things is access to care. And so one of the things I want to focus on is making sure that within our communities there are facilities like this that can provide patients with access to optimal health care with multiple resources on site. The other thing is health literacy. A lot of African American patients have often been viewed as non-compliant and resistant in going to providers, but a lot of this comes from the fact that they are not knowledgeable, and oftentimes you have certain providers and healthcare organizations that use language that clients don't understand, or they are given a prescription and not given the proper education. So one of the things we want to focus on, and one of the things that holistic practitioners will do, is to make sure we kind of focus on making healthcare available in communities where those clients will not otherwise have the ability to get to a facility, and then to make sure that our providers and our staff communicate with our clients in a way that they understand. If our clients are illiterate, making sure that someone takes the time to use language in a dialogue in which they understand, even potentially employing bilingual staff so that we can not only focus on those who speak English, but those who speak other languages, which also sometimes is a barrier when it comes to healthcare and people deciding not to go seek care.
And do you think the biggest cause of it is, like you stated, is it the number one cause you think is it more so the lack of knowledge and just them not being educated on it?
Yes, absolutely. Health literacy is a huge burden on the population, and the reason why people don't often seek care is because they don't understand their disease process. They don't understand the options that they have. They don't understand the diagnostic tests. They don't understand the screening process versus a diagnosis. They don't understand the benefits of immunizations and vaccinations. And so making sure that patients are educated is one of the big benefits and one of the goals of holistic practitioners.
And what would you say to a listener that is fearful, that has some things going on, right, in their health right now, and they're fearful of seeking that care? What are some strategies you would give them to basically help them jump to go get help and get, and see a specialist instead of just letting it happen, right? Because like you said, people are not educated on it, so they're not going to get the care that they could get to get better.
One of the things I often tell my clients is that African Americans and minorities don't get diagnosed with hypertension, and it doesn't attack our bodies more aggressively, and diabetes doesn't attack our bodies more aggressively than it does to folks of other ethnicities. The problem is that our lack of early diagnosis. So one of the things that we want to focus is on preventative measures. So going to get early screenings and early diagnosis equals early intervention. And so the earlier that we intervene, the earlier that we can include lifestyle changes and weight loss and different things and supplements to increase our vitamin D and our iron and our calcium and all of the things in our omega-3s, those things that kind of protect our organs, those are the things that will prevent comorbidities and further illnesses. So not going to a doctor doesn't actually give you a diagnosis of something bad and your failure to seek health care, but what it does is it helps protect you, because early recognition, early diagnosis, and screening and prevention are the things that help keep us healthier.
Yes, so to all of our listeners, definitely make sure you get those screenings early. You're taking your supplements and you're seeking that help and not being afraid to go get it. And like you said, Tianna, in the African American community is worse for us, right? Because we don't like to go to the doctor, right? So
right.
we need to close those gaps and start, taking care of ourselves more. So where do you see your company in the next 5 years?
So in the next 5 years, we will be expanding. I want holistic practitioners to have multiple locations throughout the metropolitan areas, Washington, D.C., Maryland, and Virginia. I want us to penetrate low-income communities. I want us to take our services ambulatory, moving throughout communities, conducting health fairs and screenings and giving people the opportunity to learn about their health, and not only about diseases, but how to prevent diseases, how to live healthy, how to protect ourselves, how to eat well, and how to keep our children well.
Yes, I love it. I love those initiatives because it's definitely needed, especially with eating well so we can live longer, right? Because I want to say, and I might not be right, but I know you can correct me on this, with the African American community, heart disease, that we have some of the highest stats in that, right? Heart disease, diabetes. I think we're like the highest.
Absolutely. Yeah. So some of the Centers for Disease Control's hard and fast facts is that African Americans, the leading causes of death are heart disease and cancer. And so one of the things that actually is a big contributor is that for African American men over the age of 18, between 2013 and 2016, they did a study and 37% of African American men over the age of 18 were obese, and 56.1% of African American women over the age of 18 were found to be obese. Now we know, well, we may not, but obesity contributes to heart disease. It contributes to high cholesterol. It contributes to insulin resistance, which leads to type 2 diabetes. Obesity contributes to a sedentary lifestyle, and it's just basically a revolving vicious cycle. So one of the things we want to do is start to live healthier, and so holistic practitioners is not focusing only on treating disease, but to give clients and patients the education and the knowledge so that they can be guarded with the tools they need to live healthier, cleaner lifestyles, to prevent themselves and to block some of these diseases that are actually preventable.
And I want to commend you for creating that space there and being able to close those gaps, because what do you think the obesity comes from, right? Because I know people sometimes think obesity, when people are obese, that they're just lazy, but I definitely, I feel like it comes more from your stress. It could come more from childhood trauma. What are some things that you think are the reasons why people are obese?
So one of the things, when you look at inner cities and the studies, one of the biggest contributors to obesity is the type of food that they eat. And if anybody's ever gone out and done a quick survey, it's crunch time, it's lunchtime, and you're trying to decide what can I eat really quick and it's not going to cost me a lot of money? Do I go to Whole Foods and go through the line and make me a salad that could potentially cost me $12? Or do I run to McDonald's and grab a full value meal that may cost me $5 or $6? I know will make me full, and I still have an additional $5 in my pocket to spend later. So one of the things is that some of the quick, easy access foods that are not that healthy are much cheaper. You can get, you can go to a grocery store and get canned goods and a pack of ramen and things like that for less than $1. But to get healthy, fresh produce could cost a lot. And so one of the things that we want to focus on is partnering with some of the local farmers and participating in some of the food drives with some of the farmers markets so that we can actually give our clients some resources so they can actually have places where they can go and get healthier foods for a reasonable price.
And I love that you're doing that because, especially with our low-income communities, because, they can't afford it, right? They can't afford to eat healthy, depending on what their, circumstances are. So, and I'm liking the fact that I'm focusing on them because I think that's some of the reasons why maybe people, like you said, the obesity is happening because they can't afford it, right? Because, we got to be honest, I don't eat healthy all the time, but I'm working on it. But it's expensive, right? So
it's very
I think
expensive.
People steer away from that because of that. So what are your views on that?
So a lot of this is out of our control, and it has to do with the Food and Drug Administration and those who make the calls because actually farmers actually get penalized, and there's actually charges to actually label your foods as non-GMO, organic. There's actually fees and penalties. So at times you have companies that are unethical and choosing not to label those things. So trying to find the resources within your community, partnering with local farmers, attending local markets, and trying to purchase, foods that are organic and locally grown could be a great option for those. And just trying your best to cook at home. Stay away from the quick, fast foods whenever possible. But again, we live in a time of hustle and bustle, and quick and fast sometimes is the way of life.
Yeah. Whatever we can get to the quickest, right? But that's something that, of course, we all have to work on. So thank you for sharing those tidbits and wisdom and knowledge with us about that. So I know you've already built your table, right, and you're continuing to build your table, but I asked all of my guests this question. How did you create your seat at the table?
Well, I wanted to take a step outside of the box. I've been a nurse for over 15 years, and I've completely enjoyed working for major organizations and corporations. There's some huge benefits, research opportunities, funding, obviously. But sometimes this doesn't always fit the moral picture in which we'd like to create. There are sometimes for these for-profit organizations, the less fortunate are often left behind. And so what did I want? I wanted to create an opportunity in which I could be proud and feel like I was truly doing God's work and assisting people and giving them options, whether it be herbal, holistic, naturopathic, or Western medicine, but just creating an opportunity to keep our community healthy.
Love it. I love it. And to all of our listeners that are listening, please support Tianna. She's doing some amazing things, and I can't wait to see where Holistic Practitioners is going to go because I'm loving all the great things that you're about to do and how it's about to expand onto a whole nother level, and it's something that our communities need, especially our African-American communities. So what did failure teach you on your journey?
Wow. And yes, we are still on this journey. But failure taught me that it was necessary, and that it's necessary to mess up in order to get it right. And so when things don't work out, as opposed to giving up, we dig a hole and we go in a whole new direction. And so I think it's one of the biggest things that I had to learn is that it's necessary. It's necessary. And even if it just provides you with a better idea, a different direction. But absolutely, you have to fail in order to actually find your way.
And a lot of us don't like to be uncomfortable and fail, but it's part of the process. So I love that you said it was necessary, because it is. So I love that. So failure, we know, was necessary, but what did success teach you? Because you are very successful. So what did success teach you?
Oh, success. Such a word I struggle with, because I don't know if I would define the things that I have done so far as successful. I have accomplished a lot, and I'm proud of where I'm going. But I have so much more to do that if I applaud prematurely about the things that I've accomplished, I don't know that I could get to the height of success in which I know that this program, this company, could do for our community. So while I'm proud of where we are and where we're going, I don't think I quite define it as success yet. We have a lot more work to do.
Well, I'm sure it's going to be amazing. I can't wait to see what it's going to turn into and how you're going to expand it. And you already have working on those partnerships to make it better, to help our African American community to be better and to be healthy and to live longer. And we need that. We need that. So thank you for creating that space and being able to reach back and pull forward to make it happen.
Yes, thank you.
So what can we expect from you in the future? We're in quarter 3, and what can we expect from you the rest of 2019?
So in 2019, by the end of the 19, we will hopefully have secured our space. We will have worked out the kinks with our wonderful insurance payers to get through the process of excessive billing and overcharging for preventative services and things that the Affordable Care Act tried to push, that when a patient goes to the doctor for a wellness visit, that should not be a fee. Someone who's trying to be healthy, someone's trying to, stay on track and be optimistic about their health status, that they should not be billed, and that only services that were rendered for illness or acute procedures, the patient should be billed for. So just trying to work out some of those kinks. But we are definitely working to secure a space, and then the next endeavor will be to actually obtain a mobile clinic so that we could move through communities where those clients will not have access to care.
I love it. I can't wait to see all the great things that you're about to do. And you're also going to be a part of a book, right? The HBCU experience.
Yes. Thank you. So I was invited by Ms. Ashley Little to help co-author a chapter in the HBCU experience, and I'm extremely grateful to my alma mater, the North Carolina Agricultural and Technical State University, for my foundation. This is where I earned my nursing degree. This is where I learned that women of color have the ability to have a seat at the table, that we have the ability to go into our communities and make a change. And so I am forever grateful, and I was able to share my experience at that institution and how it got me to where I am today.
And she's doing, like I said, it is amazing. And I am just honored and happy to have my big sister from the Alpha Mu chapter of Delta Sigma Theta Sorority Incorporated here at the table to be able to interview her today. So this is a special interview for me to have my big sister at the table who's doing some amazing things in the community. So please go support her and follow her and get involved, because she's about to do some great things for the community. So, Tianna, would you please let our listeners know how they can follow you on all social media platforms?
So Holistic Practitioners has a very undeveloped Facebook page.
Okay.
and for some legal reasons at this point, but once we get certain things approved, please come back and check for us. There will be tons of information on that page, and we will soon spread our wings out to the Instagram, Twitter networks so that we can share our information and locations and the services that we provide.
Awesome. How can they follow your personal page as well?
Absolutely. I am Nurse TP on Instagram or Tianna Bynum on Facebook.
So please follow her and support, because this is about to be amazing. So I just want to thank you, Tianna, for taking the time to come to the table out of your very busy schedule. And you know I can't wait to invite you back.
Oh, yes, and I cannot wait to come back. I hope that in the very near future I can come back and let you know that we have seen our first clients and that we are up and running and things are going well.
And I know you will be. Because like I said, listener, she's a go-getter, okay? So this is about to be amazing. So stay tuned for what she's about to do. So thank you again, Tianna. Thank you.
Thank you for having me.
You're welcome. So I would like to give a special thanks to Tammy Collins-Marquis and John Schamberger. I would also like to give a special thanks to author Kimberly McLemore, to my intern Savon from Virginia Commonwealth University, and my intern Sarah from Tennessee State University. You all may follow me on Facebook at Ashley Little and on Instagram at _Ashley A. Little. Thank you.
Thank you for tuning in to another episode of Creating Your Seat at the Table, where Ashley speaks with corporate professionals, celebrities, entrepreneurs, authors, and speakers who are transitioning or have transitioned to entrepreneurship.
I am so delighted to share with you this book, Fierce. Fierce was a vision that God gave to me during the greatest battle of my life, and it was birthed through fire from my very existence. This book was written to encourage you, strengthen you, and to inspire you that you can be strong and you can hold on by the grace of God. It is available through ebook on Amazon. And we speaking of books, I want to introduce you to Visionary Coaching and Consulting Group, LLC. We offer child care coaching, ministerial coaching, author coaching, pastoral coaching, motivational speaking, inspirational speaking, conferences, and so much more. Our vision at BCCG is seeing your words come to